The Democratic Nursing Organization of South Africa, or DENOSA in Gauteng, has condemned austerity measures imposed by the National Treasury over a year to freeze the hiring of new employees, except for instances where offers of employment have gone out already, and to hire only critical employees if motivations are submitted by the heads of departments. DENOSA Gauteng chairperson Simphiwe Gada has called on the National Treasury as well as the Premier of Gauteng, Panyaza Lesufi, to give bureaucracy to hospital officials to appoint as well as dismiss staff. Professor Alex van der Heever from Wits School of Governance joins us now to weigh in on the current challenges that are affecting the healthcare system in the country, particularly here in Gauteng. Prof, as always, great having you with us. Very good afternoon to you. So let's first discuss the intended rollout of course, the first phase of the NHI, with the President having requested BUSA to put forward specific proposals on the remaining issues of concern as a basis for further engagement. So what is your expert opinion on these developments? Are we ready nationally to start with the implementation of the national health insurance?
The short answer is no, and I think that there are clearly going to be a large number of contested issues going forward. The request for information and proposals from BUSA is in some senses odd, because the process has been continuing since 2009 and it's 2024, and still requesting proposals suggests quite a lot of insecurity about the proposals themselves and the way forward and the court cases that are currently being initiated. Some already in the courts, some going to be in the courts at some point.
Kind of like the Bella Bill there, Prof. So there's also a wide range of issues that have been raised about the NHI, especially from the private sector. Throw in the mix that, of course, our government hospitals need serious upgrading. I mean, I'm talking from technology to infrastructure, as well as staff attitude, as referenced in the recent video by a patient at Helen Joseph Hospital. But this is obviously going to be a lot of work, Prof. And DENOSA openly supporting the implementation, saying that critics will always be there against a change as well as progress.
So there's people can say that there are critics against particular proposals, but they'll be criticized if they're bad proposals as well. So they're merely stating that there will be criticism isn't really a coherent argument. There are serious concerns with the NHI framework as proposed and the bill and the Act itself. So it's very likely that it will continue to be challenged. But it's also very unclear what people think will be implemented in terms of this, because a large part of the concern with it is that it is a proposal that is beyond the capability of this government to implement. And there are large parts of it which don't appear to be implementable. So it's not really opposition, they're not actually implementable. So, and because this discussion is very often handled at a sort of fairly superficial level, going into the detail of exactly why it's not implementable is actually the serious requirement now. So merely calling for people to stop opposing this and allow it to go through doesn't really help, because a large part of what needs to be done now is to correct what's going wrong in the health system, rather than pretending one's going forward with a reform which really will never be implemented. That's really the technical concern with this proposal.
And Prof, let's now focus on the media briefing by DENOSA earlier today, where they basically raised quite a few issues, mostly centered around the Gauteng province health department challenges, like being short-staffed or corruption among doctors and nurses who they say are billing for work that they didn't actually do, how shifts are actually allocated. But to be quite honest, this is literally a national concern, Prof. We hear the same stories in every province. So who needs to actually be start cracking their whip at this stage?
Well, part of the problem here is that there have been very significant increases in employment in the Gauteng Health Department over the last 10 years or so. So it's not as if there hasn't been a continuous improvement in resource allocation. The short-term problem isn't about austerity. It's about the fact that salary and wage increases were given, and arguably as a political deal, to the sort of ANC-affiliated trade unions that was not affordable and that government couldn't actually pay for. So they were only partly funded in going into the provinces. So the natural concern, the problem that gets created is once you've increased the unit cost of your staff, and you can't afford it, then you're going to have to cut posts. There's no other way out of it. You can't borrow money to fund the difference. South Africa's budget is already so constrained, you can neither increase taxes nor can you increase borrowing any further. So you're ultimately left with a problem in that the budget basically isn't there for the staff establishment at their cost. So this is going to be a problem for all provinces, but in Gauteng, there's also the problem of significant corruption, which is also removing a large portion of the budget, which should be allocated to improving and running services. And that corruption is not stopped.
And Prof, that's exactly what I wanted to say, that the issue of budgetary cuts are some of grave is some of the issues that is of grave concern, especially when you hear that the money was actually allocated but diverted to other projects that some can't even be accounted for. I mean, the Auditor General there pointing to billions lost in fruitless expenditure within the sector, and this is unacceptable. Our public healthcare system is currently in tatters as compared to what it should be in terms of standards.
Yeah, so this is despite the fact that there have been very substantial budget increases since 2000, very, very huge, very, very significant increases. But when you look at the irregular expenditure, in particular in the Gauteng Department of Health, it amounts to 6.2% of the personnel budget. It's a significant expenditure. It's accumulated since 2015 to 2022-23 is about 16.5 billion rand. And the SIU has indicated just in Tembisa alone that the investigations have now been expanded to 3 billion rands just from one hospital. And you have to really ask, what are the people in the Gauteng Department of Health doing when you allow in a single hospital 3 billion rands worth of irregular, not just irregular expenditure, this is now being investigated as straight fraud. And these are all transactions that are under 500,000 rand that were in a given period. And the question is, how widespread is this? Because the proclamation for the SIU investigation is limited only to Tembisa Hospital. It should be expanded to the entire Gauteng Department of Health, not just Tembisa Hospital, because quite clearly it is not just restricted to that department. So this is where the money is actually going, and it's not because Treasury is under allocating. You can allocate more funds, but more funds will just be stolen.
Absolutely, Prof. I mean, also this, I suppose, points to the recent report about the claims, particularly around medical malpractice that were actually filed by particular law firms, basically working with some of the hospitals. So there is quite a lot of issues that need to be ironed out within the sector. Prof, as always, great input. Thank you so much for that. Professor Alex van der Heever there from the Wits School of Governance.